What's going on, everyone? Happy Sunday. Happy Father's Day to all the fathers who watch my channel and all the fathers out there. Hopefully everyone is doing well, staying safe, healthy, and having a great weekend so far and testing negative for the viruses. It is time now for the Sunday edition of the Virus Update for Sunday, June 15th, 2025. If you are new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. There's a lot of viruses out there, but not enough media coverage. That's where I come into play. Alrighty, if you're new to my channel, subscribe down below. Give this video a thumbs up. Hit that notification bell. Share this video with anyone you know. And of course, if anybody has a comment, please leave it down below. We do have several things to get through today. In the news portion of this video, that's going to probably be at least the first 5 to 7 minutes. Then we're going to take a look at some daily things. And, of course, it is Sunday, which means we will look at wastewater data today. And I do have a little sheet here of paper with some notes with various different things we need to look at when it comes to wastewater. We will not be doing that international wastewater page we found last week today. I think I'm going to get to that tomorrow. I don't even have it queued up for today. So, starting off with this, in Los Angeles. Yesterday we talked about California is not doing great. Well, Los Angeles, California is not doing great. This was put out on X by Sci-Fi. We're going to see a lot of things from X today that I found yesterday. Los Angeles, for 3 weeks in a row, COVID positivity rate has been increasing and is the highest since September at 5% for the week ending on June 7th. And you can clearly see it here. This green line, which is COVID. It is starting to rise in Los Angeles, and numbers overall there are starting to rise. But I will say this. Look at this red line or orange line. You can see it's not rising like it did last year just yet, but you know what? It's coming pretty soon. It's going to start to rise, and based on what's already happening, I can just already tell it's going to be another summer with COVID in Los Angeles. It's going to be another summer with COVID in a lot of places. All right, this is something random I found on X. This is from Sarah Allen. They often post stuff about New York City, and I thought I would share this. New York City reported 2 more pediatric COVID deaths this week. That makes a total of 67. 5 of the pediatric deaths are just in the first 5.5 months of 2025. And take a look at this. Now, this may be a little confusing to you. I'll make it make sense. You can see here they show the dates, they show the years, the hospitalizations, various different things. Then it shows the death count. Then we have age numbers right here, 0 to 17. And you can see here, I have it highlighted in blue. It is up to 67. It was 65, so that's that 2 pediatric death increase. Not good considering this happened basically during the law period. So that is relatively concerning for New York. All right, wanted to share this with you. I think we shared it before, but if you're new around here, or maybe you didn't know about it, that NB.1.8.1 variant, also known as Nimbus, apparently one of the major symptoms with this is a razor blade sore throat. Yeah, this is not a good thing. I mean, obviously, most people will recover from a sore throat, but it's just very uncomfortable. Just adds to the misery of testing positive for COVID. You know, you have COVID and or you feel sick and then you take one of these at-home tests, which most people do nowadays. PCR testing is not really much a thing anymore. And you end up testing positive, and you call your doctor or whoever, say, hey, I tested positive, what should I do? And then during that time that you're positive, you get that sore throat, and apparently with the NB.1.8.1 variant, that sore throat is just extra miserable and feels like razor blades in your throat. Yeah, a quick reminder, today is Father's Day. If you're going to visit someone, nursing home, maybe you're going to visit your father, chances are maybe you've already done that because half the day is gone already. Please make sure you're testing beforehand. Very important that you do that. But yeah, the NB.1.8.1 variant, it is spreading around the world. However, XFG variant, which is another variant of COVID, that one may eventually outdo NB.1.8.1. All right, taking a look at this. This is not good whatsoever. Whooping cough cases rise sharply in Washington and Oregon. Health officials urge vaccination. More than 1,300 cases have already been reported this year in Washington, and there have been 877 cases reported in Oregon, with the majority in Washington County. Now, I don't know. Are things just especially bad in these states? I mean, yes, there's some population there, but we got some states that are far more populated, like California, Texas, Florida, New York State. I don't know. Are things just especially bad here, or are they not testing enough for whooping cough in other states? Or are people saying, "Oh, it's just a cough. It's just a cough. My child's fine. There's nothing wrong with my child. My child is not sick. Trust me." I've run into a few cases of that since this COVID has all started, where I'd be out doing my deliveries or whatever the case may be, and I see someone coughing, and people start staring at their little child for coughing, and the person just freaks out. The parent just freaks out and says, "There's nothing wrong with my child. He's fine." Blah blah blah. Yeah, but so who knows? I mean, these are really high numbers. 1,300 cases already this year, in Washington, and 877 in Oregon. Yeah, that's not good. But the whooping cough news continues. Louisville Metro Health concerned about increase in whooping cough cases. Yeah, this is not good whatsoever. Kentucky's doing especially bad. There were 543 cases of whooping cough reported in 2024, the highest number of cases in the Commonwealth since 2012. Already there are 247 cases of whooping cough have been reported this year in Kentucky. Will they surpass last year? I think they're on track to at least come pretty close to last year's number. So, yeah, whooping cough, it's definitely an issue. All right, Meet Jess posted this over on X. You may remember this person. I did a few spaces with them over on X a few years ago, if you've been a long-time follower of me on X or here on YouTube. But oral conditions associated with COVID-19. And she used a little excerpt from this article. We're just going to read the excerpt here. Dentists are noticing that patients with long COVID are experiencing tooth loss, graying gums, and tooth cracking alongside at a higher rate than usual. Yikes, that doesn't sound good whatsoever. All right, just thought I would share that with you. And of course, here we go. The final news piece for today. This is Wastewater Scans weekly data report. This has to deal with wastewater and their report of what's happening in the United States. Right now, they only do the United States. I don't know. That would be really neat if Wastewater Scan could start branching out to other countries. Maybe that'll one day be a thing. They just added measles, so who knows. All right, Respiratory Weekly Update. All respiratory viruses we monitor, or they monitor, I should say, SARS-CoV-2, RSV, Influenza A, Influenza B, HMPV, EVD6A are in the low category nationwide. Now they're staying low here for COVID, yet we've seen several times where it comes up medium or high for the national level under like whatever. COVID-19 nationwide. SARS-CoV-2 is in the low category with low concentrations and get this, no significant trend over the last 3 weeks. Hey, that's a really good thing. COVID variants in sequencing wastewater sites, LP.8.1, a descendant of KP.1 in brown here is at 35.8%. NB.1.8.1 is in 13.1% at this time. XFG is 10.3% and make up around 59% of the variants. And then, of course, just a lot of other random stuff. Because someone left a comment the other day saying how many variants there are. It's true. Since COVID started, how many different subvariants have been found? It's in the thousands. Would you believe that? Influenza A and Influenza Blue are in low category. Not doing bad at this time. H5 has been detected in 28 states. RSV is not doing bad. We really don't need to read the rest of this, simply because we're coming out of season for most of these. However, HMPV, you can see here, it's still elevated in some places. So, yeah, HMPV, yeah, it's still an issue out there. All right, moving on now. Let's revisit the UK. And the UK for COVID this week, yeah, their cases went up slightly. 1,211, that was up by 78. Deaths this week, they had 63. Healthcare numbers, 947. I don't understand that because I thought it was higher last week, and here they say it's an increase. I don't know. Make it make sense, because it doesn't make sense to me. Taking a look here, 6.32% is the positivity rate for COVID in the UK. Taking a look at what's going on with the other viruses, you can see influenza looks to be fine at this time. And let's do our search here on the page. Let's find measles, shall we? Whoops, that's not how we find measles. Because we do want to see what's going on with measles in the UK. And they're reporting 420 cases, 75 cases in the last 4 weeks. So measles, yes, it's an issue there as well. It's an issue here in the United States. We know Canada is doing really bad with measles. So a lot of places are having measles issues. All right, air quality values continue to be a problem. I can already tell you, air quality is not great here today. We're recording this early today, and if you would have caught me just a little bit before this video, yeah, I was doing a lot of coughing this morning. It's the long COVID, asthma, air quality, you name it. It hits me sometimes. And luckily now I'm okay. Take a look here. We can see the Northeast. Just a lot of yellow and oranges. We're not seeing the reds or the purples. We're seeing a few of them, okay, in the Southwest. But generally just a mixture of these oranges and yellows. And that seems to be an issue for many places. They all the way back to the Northern Plains, portions of Texas, the Great Lakes, the Northeast. California, we do see down here in Southern California, right at that Mexico border, see a few oranges and reds there. Florida today, not doing terrible. Couple yellow spots here and there, but overall, not as bad as other places at this time. Taking a look at Canada, your viral activity level for wastewater for COVID is moderate. Flu A is low, Flu B is low, and RSV is low at this time. Taking a look at what's going on for Philadelphia yesterday, I don't know if we can or not. No, it did an update, so we still have Friday's total, which was 854 EMS incidents. Sometimes this number comes in later on Sundays, so we'll report Saturday's number in tomorrow's virus update. Taking a live look in at what's going on in Montgomery County, Pennsylvania, and I do need to refresh this. And take a look at that. Only 4 calls on this Sunday morning. That is fantastic news that they are not doing bad this morning. Taking a look at what is going on in Chester County, Pennsylvania. Whoa, we see sick person, not once, not twice, but 3 times. We also see respiratory difficulty showing up here, so that is not good. And let's go backwards for a second. Did we forget to do Pinellas County, Florida? We did. And we can see sick person is showing up there. 1, 2, 3, 4, 5 times sick person is showing up in Pinellas County, Florida, so that is not a good thing. Taking a look at what is going on with the hospital situation in Pennsylvania. Yeah, there's a few hospitals dealing with problems. Even a hospital there in Carlisle today. And that is a behavioral health issue with what's going on there today. A few hospitals in the Lehigh Valley and a few showing up with issues in the Northeast today. All right, let's take a look in the Northeast portion of Pennsylvania, that is. Let's take a look at Pennsylvania wastewater. And Pennsylvania for wastewater on a statewide level is still not doing bad for COVID. You can see here, COVID is still, it has actually dropped a little bit, which is fantastic news. I'm glad to see that because if you did not hear, next week I'm going to be visiting some relatives up here in central Pennsylvania. Actually, there's going to be quite a few relatives I'm visiting from various different places that we'll meet up there next week. So, but you know what? The virus update will continue. But what I'm leading up to is I'm glad. Let's check COVID wastewater up there. Hey, still not doing bad in State College, Pennsylvania. That is good to see. Moving on to New Jersey. We can see here that in New Jersey, the hospital situation is not doing all that bad at this time. Take a look at this. Just one place dealing with a problem. It is University Hospital. I refreshed this because yesterday they were dealing with that problem. And let's see. Are they still dealing with it? Inspira Medical Center, Mannington specialty. And yeah, okay, so University Hospital still has an issue today. All right, taking a look at the latest from New York State, 433 positive cases on Friday. The hospitalizations, I think they may be at that moment where they're going to start rising relatively soon. All right, let's take a look at some CDC stuff now, shall we? And we do see COVID is likely growing for epidemic status in California. And let's take a look at what is going on when it comes to wastewater. And we can see the national levels for wastewater. For the most part, most regions did go up except for the Northeast. The Northeast region did not rise for COVID. Now let's go to the state, territory, and trends. First off, Alabama is very low at this time. Alabama is doing great when it comes to COVID. Now we want to take a look at California and see what's going on there. And chances are California is going to be probably still rising at this point. Let's click on the state level. And yeah, you can see here it is snaking its way upward. It's not far off from going moderate for COVID in California. Yikes, that is not a good thing. That's not something we want to see whatsoever. And I also do have here written down that we need to take a look at Florida and see what's going on there. Let's check on Florida. And we can see that, yeah, Florida is also not far off from moderate. Let's do another check of Arizona. Remember, Arizona was starting to rise a few weeks ago. Arizona is still low. And look at that. They actually went back down. Let's take a look at what's going on in Washington now. The state of Washington, that is. And you can see Washington at this time. Wow. Almost in the very low, so it came back down. That is interesting. It could be this wave that we're about to experience remains delayed until XFG takes over in the United States. That is something that is definitely possible. Let's take a look at somewhere in the Northeast. Let's take a look at Maine, shall we? And Maine at this time is in the very low category. That is good to see. All right, I do have several wastewater sites that we need to look at on Wastewater Scan. Here's one of them. Now, this is Bridgewater, New Jersey. I was debating whether to even show this because I think they either have an error or incomplete data. Notice how for COVID, first off, it's listed for high. And notice how it rapidly went up, but it was only over 4 updates. That seems to be a magic number when it comes to Wastewater Scan. When it does this rapid upward movement, but it's only over 4 updates, that seems to be where it's going to end up getting correct. Could they still be going up? Definitely. I think it's going to be less harsh than this. So, yeah, COVID there is listed high. Let's look at some other things. Low for RSV, low for influenza A, influenza B is low. Let's see here. HMPV is low. Norovirus is still listed at medium at this wastewater facility. And hey, no detections of measles there. Now let's go to West Boise, Idaho. I do have that written down here. West Boise, Idaho. I believe that would be this one right here. Yes, here it is. COVID is listed at medium. We can see this one is several updates. And it's medium. And it is going upward. So that is concerning for COVID. 186,000 population at this wastewater site. RSV is low. Influenza A is low. Influenza B is low. HMPV is low. EVD68 is low. And norovirus, yeah, it's listed high. And take a look at that. It is still rising somewhat. Hepatitis A at this time is not detected. Mpox is not detected. Not detected for any of the other stuff. The latest detection of hepatitis A, you got to go all the way back to, when is that? March 17th. All right, let's pause for a second. Let's take that hydration break, shall we? I need to be hydrated, and you need to be hydrated. Doesn't that feel much better? All right, continuing on. I have in my notes here, we need to take a look at a couple things in Florida. We'll go to Orlando, Florida, and then Miami, Florida. Then we'll do 2 more random wastewater sites, and that will be it for today. And take a look at this. Yeah, there's now 2. Orange County, Florida now has 2 orange sites, meaning high COVID levels. We can see here. First, at the Northwest facility, it is rising. Take a look at that. You can see it's definitely rising, high for COVID. Everything else, for the most part, is fine, but norovirus is really starting to see a rise. Take a look at that. That's not good. We're going to have to keep our eyes on that one. Mpox, you do now have a detection back on May 11th. Let's take a look at the other Orlando wastewater site, Southland. There's several here. And this one is rising even faster when it comes to COVID. Norovirus, not as much of an issue here. HMPV, a little bit of a rise there. We'll have to keep our eyes on that. Some detections of hepatitis A. Let's go down to Miami now, shall we? And in Miami, we can see here that, oh wow, COVID is rapidly starting to rise. It's listed high. Influenza A is listed high. Norovirus is rising again, listed in high. And a lot of detections of hepatitis A. Yikes. Miami, you are not doing well at this time. This is not good. There's another one, North Miami. This one's medium and gradually rising for COVID at this time. Medium for norovirus, but that is on a downward trend at this time. All right, let's do 2 more random wastewater sites, shall we? Let's go up here to just north of Atlanta. Yikes, Roswell, Georgia. This is actually concerning. Roswell, Georgia is listed in the high category at this time. And yeah, for COVID, it is going upward. Influenza B is still high, but you can see it looks like it is starting to go downward. Norovirus is still medium at this time. And we do want to take a look at that other site that was orange also. Big Creek. This is Roswell, Georgia. High and gradually rising at this time. HMPV, wow. Take a look at this. High and, yeah, that's continuing to go up. That's not good. Norovirus, a little bit of an upward trend at the end, and that is medium as well. Everything else there is fine, and since we did 2 there, I did say 2 random wastewater. I didn't think it would be 2 in the same area, Let's go to Salt Lake City, Utah. This is where we will end for today. Medium for COVID. RSV is low. Influenza A is low. Influenza B still is at high. HMPV is high. EVD68 is low. Norovirus is medium. Hepatitis A is doing okay. You see everything else is fine. And you know what? Feeling extra generous today. We didn't do anywhere in the Midwest. So let's go up here to somewhere in the Midwest. See in Louisville. You know what? Louisville's coming up high. That's close enough. Jeffersonville, Indiana. That's high, and yeah, that's starting to rise a little bit at this time. And everything else is fine, except for norovirus is medium and rising slightly. Alrighty, folks, that does it for the Sunday edition of the Virus Update. We'll have another Virus Update again tomorrow. If you enjoyed this update, give it a thumbs up, subscribe down below, hit that notification bell, share this video with anyone you know, leave your comments down below, and ways to support the channel are down below. Thank you, everyone, for watching this video. I will see you again tomorrow. Until I see you again tomorrow, stay safe, everyone. Have a fantastic Sunday, and happy Father's Day. Take care. Bye-bye.